Hello everybody, my name is David Rivera. I'm a disabled U.S. Naval veteran. As of 2006, here, my blue card for anyone who wants to see it. Yep, that's fine. 2005, I suffered an injury to my neck. I had a disc blow. 2006, from taking the drugs to lessen the pain of the injured disc, which has caused these three fingers to constantly tingle. They'll turn oddball colors. I lost 75% muscle in my chest, of which I put a tattoo on there to hide the deformity. I lost almost 80% of my tricep muscle in my right arm. I have taken many drugs over the years. This one is actually called gabapentin, which is generic for Neurontin. I take 1,800 milligrams of this a day. The maximum prescription is 3,600. Recommended, that is. The second one, which I take for arthritis or degenerative disc disease, is called meloxicam. Let's see if I can show it to you. The third one, for dealing with the other injuries, is called cyclobenzaprine, otherwise the generic name for Flexeril. I call this my stupid pill. I take this when I absolutely have to, because I last about 30 minutes and then I go to sleep. And then for when it gets really bad on bad days of nerve pain and nothing wants to quit, I'll take this drug, which happens to be hydrocodone, i.e. Percocet, if you can see in the middle. So those are were my normal everyday drugs. In 2006, I suffered a back injury, which I was actually diagnosed when I was retired from the U.S. Navy. I did 20 and a half years. 5 of those were deployed on board aircraft carriers at sea, not sitting at land. Thanks to a little bit of luck and a whole lot of searching, trying to find something that will work, my injuries increased. Not only do I have the fingers, I also have what they call drop foot syndrome, which basically is a nerve blew in my lower back, the L4, L5, and S1 area. Because of that, my foot went numb on the right side. You can stomp on my big toe and I'll feel that one. You can stomp on my little ones and I won't feel a thing. Unfortunately, I suffered nerve damage. With nerve damage comes something that we call nerve pain. And it can be excruciating bad, to the point where your muscles turn oddball colors, your body says hello, you end up having great adjustments to weather. If you're in a high humidity area, you're like me and you can tell when it's going to rain and when it's not. I got lucky. I found something called LEVARE. This drug right here. It's all natural. Now, I'm going to explain a little bit of what happened. With my injuries, I started taking the Neurontin drug, or gabapentin, and I take it with Mobic. Some people use Celebrex. I have degenerative joint disease and degenerative disc disease. So basically, in probably 15 years, I'll be running around in a wheelchair. Although some days I'll be moving faster than what I actually am. Because of the LEVARE, I was able to quit taking Mobic or meloxicam, Flexeril, I don't like to take because my stupid pill, and I don't take Percocets. And instead of taking 1,800 milligrams of this, which this particular drug is designed to do one thing, it's designed to deaden the nerve pain. By that meaning, it will sit there and basically make you numb. Now, 1,800 milligrams is a lot. Because of this particular added drug, which is all natural, got to show you the label. And yes, here, I'll get it up close so everybody can see this. I'm doing this video because I want people to know. I'm not getting anything. I ain't worried about it. I know where to get what works. And here I'm here to tell you. I'm in VA healthcare. I also have my TRICARE healthcare, and I can go out in town anywhere I need to go. They keep wanting to give me narcotics, Vicodin, Percocets, anything you can possibly think of. And I'm sorry, I don't like being a druggie. I'm only 50 years old. I've been retired 12 years. And at this point, it's like, okay, what's next? I would like some semblance of a little bit of my life back. Well, LEVARE has done it. I'm not telling you that, and I hope I'm pronouncing the name correctly. I'm not going to sit here and lie to you. I put a review on this particular drug via my nickname, which is AKA Voodoo Man. Neurontin did some beautiful things. It did help, and it has helped, and I'm never going to, unfortunately, get off the drug because I'm getting worse. LEVARE has delayed me having to take these other drugs along with being able to lower the dosage of my own prescription, which, should I? I don't know. It's a practicing thing by doctors. Do they say yes, 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 yes? Sometimes people don't like to listen to anybody else. I'm not a doctor, but I can tell you, in my case, heavy drugs like Percocets and whatnot don't really affect me. I don't like taking these drugs because they can cause other problems, such as high blood pressure and anything else. And unfortunately, in my particular case, eyeballs. Yes, at the age of 40, I went from being able to see perfectly fine to blind as a bat overnight almost. It was like something kicked me, and it was very strange. I now wear prescription glasses, and these are prescription here. These are not sunglasses. And I wear bifocals. The one thing I can tell you people, and particularly anybody from the U.S. military medical services that are looking at this video, y'all need to get your hands on this drug. The U.S. military personnel that are watching this always went to medical at least one time in 4 years, or 10, or 20, or however long they stayed in. And they complained of a pain. And what they give you? Motrin. Beautiful, huh? Well, guess what? After so many years of taking that, it doesn't work anymore. If I take Motrin now, I take 2,000 milligrams of the generic, buy it over the counter at Walmart, Target, Walgreens, CVS, wherever. I buy the generic version. I have to take 2,000 milligrams for it to even affect me. So yes, I have to take a lot of drugs. I weigh 235 pounds. I was 200 pounds when I retired. This particular drug right here, it's natural. It has something in it called white willow bark extract. And I'm telling you right now, it works. It lets me get rid of a whole lot of other drugs. It doesn't make me feel stupid. And when I mean stupid, has anyone ever been falling down drunk to where you can barely walk? That's what Flexeril does to me. I don't like that feeling. Never liked this feeling. This particular drug does what you need it to do. It will relieve pain. And not just nerve pain. It helps the entire body. And the one thing I liked about it the most is because my body was able to relax. And the muscles relaxed naturally. It wasn't anything. When you have nerve pain, the muscles contract right around the nerve. You don't get them loose, you're going to be hurting. Well, LEVARE has done that and relaxed the muscles around the nerves. It works. The team that came up with this and figured it out and put it together, thank you very much. As for the people in the medical field, and I hate to say this, and please forgive me, anyone that I might offend by this particular thing, everybody that's in the medical field is always practicing. It doesn't matter if they're a nurse, a CNA, a doctor, or a neurosurgeon. They're always practicing. Well, they learn the better ways by listening to the patients. If they listen to the patients, they're some of the best in the book. I wrote a review for this. As I said, it's on the website for LEVARE pain relief. Unfortunately, if I had a sign, I'd hold it up for you, show you both. There's both my hands. So, if you want pain relief, If you think I'm crazy, I would show you the scars on my back. But unfortunately, I'm not a 20-year-old with a decent-looking tushy, so that's not happening. In the meantime, people, and yes, I do have shown you all my drugs, and I am retired military, and I am a disabled veteran. For the people in the military that are deciding whether or not to use this drug for the military personnel, you might want to take a very close look. I'm not out to make money. I'm out to help people. If I can help people by this, because, nobody wants to hire a 50-year-old broke individual that happens to be an ex-military guy, because we all think until they work different. We're not normal because we've been trained a certain way. But please forgive any of my craziness. But this, I'm going to continue to buy. Why? Because it works. So, you can either believe me, or you can write and get a little sample of the bottle off the site. Here, I'll hold it up so y'all can see the name one more time. It's LEVARE. Google it. You'll find their website. It's a good thing.